Our first presenter is Dr. Alyssa Provencio, Assistant Professor in the Department of Political Science and the Master of Public Administration program here at UCO. Dr. Provencio works on diversity, equity, and inclusion initiatives across campus. She is the Director of the Leadership Minor, President of the Latino Faculty and Staff Association, and serves on the Faculty Senate Executive Committee. Dr. Provencio's teaching and research interests includes issues of representative bureaucracy, consensus building, and community empowerment in the discipline of emergency and disaster management. Professionally, Dr. Provencio has worked for a number of nonprofit organizations, including the Clinton Foundation, and attributes her passion for emergency management to the time she spent in New Orleans following Hurricane Katrina. Last year, she was awarded the new Faculty Member of the Year by the College of Liberal Arts. Please give a warm welcome to your first presenter this afternoon, Dr. Alyssa Provencio.
Good afternoon. What an excellent opportunity to be able to share the stage with so many dynamic change makers in our community, all who have unique experiences and a passion for working toward a better future where more people feel like they belong and are celebrated. I count myself among those who would say they are enthusiastic about this work, so it might be a surprise that I'm going to kick us off by saying, we have a DEI problem. When George Floyd was murdered in Minneapolis in May of 2020, at the height of the pandemic, it was during a time when we were experiencing unprecedented worldwide loss. People were outraged. For some folks, mostly in Black communities and other communities of color, this rage was not new. The overwhelming sadness at a life that was ended too early felt all too familiar. However, for others, this anger, and in some cases guilt, was new, and they wanted to do something about it. Then came the period of what I'll call the DEI explosion. Everywhere you turned, companies and organizations were issuing racial justice statements and hiring for DEI managers, consultants, and officers. Governments and institutions were creating councils and task forces. Training for cultural sensitivity or competency became required. I'm sure this probably sounds familiar to some of you, maybe many of you. I am guilty of partaking in and even convening one or two of these types of initiatives myself. You see, this was a time of great excitement for those who had been working on these issues because it seemed, at last, that people were paying attention to how necessary it is. But it was also a time of great skepticism. I recall many conversations that went something like, yeah, this is great, but how do we sustain it? So today I'm going to talk about 4 problems that I see in DEI conversations today. Number 1, the language we use is itself exclusive. Number 2, these are not just concepts. People's lives are at stake. Number 3, we forget that we are building upon the lives and the work of others. And number 4, companies, organizations, and institutions did not know what they were getting into. Number 1, the language we use is itself exclusive. You'll notice that thus far I've only used the acronym DEI. I am assuming that for many of you, since you've chosen to attend and are interested in these issues, you are likely familiar with this acronym. There are others, however, that have not chosen to attend and are here because your professor made you come for credit. Shout out to my 1 p.m. A&G class who are here today. So you may not know what these letters mean. I'm going to use my advantage being in pole position to give some basic definition to these terms that we use so often. D, diversity. This essentially refers to the composition of an organization and the various identities that may be represented. This may mean categories most often listed in definitions of diversity, such as race, ethnicity, gender, sexual orientation, ability, religion, or others not always included, such as gender identity, veteran status, or ideology. E, equity. Equity refers to the removal of systemic barriers or providing resources to people or communities to overcome those barriers. I'll talk more about equity in a bit. And finally, I, inclusion. Inclusion refers to whether or not someone feels fully included or like they belong in an environment. For example, a queer person may not be fully comfortable telling their colleagues about their same gender partner. Or a child of immigrants may not want to bring their traditional food to lunch because they fear their classmates will make fun of them. Now, I know there are people in the audience who are already analyzing my definitions or picking apart my examples. In conversations I've been in over the past year, there seems to be a lot of language policing, but maybe that's just a side effect of being in higher education. There are arguments about which words are most appropriate and least offensive. There also seems to be a woke contest. Who can be the most up to date with the language that they use? While I am a lifelong learner and believe in the power of words, most of these disagreements over exact terminology and conceptual arguments such as, is diversity a product of inclusion or vice versa, to be elitist and frankly unhelpful. Additionally, these practices alienate folks who may be new to the conversation. They may feel that if they don't know exactly what language to use, then their idea may not be welcome. I have talked to so many people who have said that they want to help, they just don't want to say the wrong thing. Number 2, these are not just concepts. People's lives are at stake. In our attempt to bring DEI to the masses, I believe we sometimes lose sight of the fact that actions we take impact people's lives. My academic discipline, as mentioned earlier, is emergency management, meaning that I study the impacts of extreme events, such as disasters, on society. In particular, I'm interested in how these events affect our most marginalized and disenfranchised communities. So when I think about equitable housing, for example, I think about how if you live in a mobile home, you are more likely to die from a tornado. I also think about how mobile home parks or developments are not required to provide tornado shelters in tornado-prone regions of the country, meaning that when you boil it down, we are codifying death. Why? Because shelters are expensive and are a liability to the owners of these developments. Profit over people. When I think about equitable transportation, I think about how every time there is a mandatory hurricane evacuation, there are hundreds upon hundreds of people who do not have access to a vehicle or to reliable transportation. Even when there is access to some kind of public transportation during an emergency situation, are they able to accommodate people with disabilities, or do they provide assistance to elderly travelers? There are many reasons why people don't evacuate during these types of flooding events, and most of those reasons have to do with inadequate social support. When I think about equitable health care, I think about 26 million people who do not have health insurance in the United States, and the subset of these people who did not seek medical care when they contracted COVID-19 and died because of it. I think about the Black and brown communities who do not trust the vaccine that could save their lives because of the horrible atrocities that medicine and government has afflicted upon them both historically and today. You might say, well, those are extreme events. They don't impact our daily lives. But I argue that they do. The outcomes we see in disasters are only an amplification of the disparities we see in daily life. Number 3, we forget that we are building upon the lives and work of others. DEI work didn't begin May of 2020. We are building upon the literal blood, sweat, and tears of our ancestors. We are only able to talk about these issues so openly because of the work of those who came before us. Without the resistance of the enslaved people who fought against their oppressors, and the resilience of the native people who persisted in the face of colonization, and the beatings and imprisonment of the protesters of the civil rights era and today, DEI wouldn't even exist. We must also reach out and include those who are working in DEI long before it was popular or accepted. What have they done that we can make stronger? And finally, 4, companies, organizations, and institutions did not know what they were getting into. I recently reached out to colleagues, both present and from former jobs, to describe DEI work in one word. So many of them don't know how to follow instructions and gave me many words, but nonetheless, these were the results. While many said that the work is exhausting and time-consuming, they also recognize how necessary and life-changing it is, both for them and for those they work for. The question is, do all people see it this way? When the barrage of statements erupted from these companies, organizations, and institutions, there came a resounding, "And now what?" You say these things are important, but where is the action? When you invite people to work on DEI issues, you are essentially asking them to disrupt the status quo. You are saying, "We know we have a problem, and we need your help to fix it." For DEI to truly work, you have to question the entire foundation upon which you are built. Because so many of the problems we face are systemic and are built on racist, sexist, and ableist assumptions, there is no easy fix. Having priorities and goals related to DEI doesn't equate to having a sales goal or an enrollment goal. We can't just say that when we reach those numbers, we've succeeded. DEI can't be contained to a single office or division or group of people. DEI permeates everything, everywhere. Commitment to DEI is constantly changing and evolving. This work will never be done. In higher education, we focus a lot on recruitment and retention of students, but also faculty and staff. Through a lens of DEI, we start to disaggregate these numbers by gender and race, ethnicity. We might also look at how many of our community identify as disabled or queer. But numbers aren't enough. We have to examine the lived experiences of people while they are on our campuses and in our community. Do they feel valued? But I'm an optimist. So in response to the 5 problems that I've outlined, I also have 5 solutions. Number 1, use accessible language. When people know what you are talking about, they are more likely to participate. Number 2, think about all of the implications of your current practices. Are people's quality of life or actual lives at stake? Number 3, reflect on the work of those who came before you. Lift up those who have been working on these issues longer than you have. Number 4, if you are a leader, be prepared to change. Be prepared to be challenged, accept the challenge, and give resources to those working on these challenges directly. If you aren't in a formal leadership position, lead from where you are. Do what you can within your realm of control. And to everyone, listen. Listen to the stories of others and believe them. Thank you all so much. Enjoy the rest of your afternoon.